Let's turn our attention to Lagos State, where the state governor, Babatunde Raji Fashola, has urged Nigerians not to panic, I should say. He says they shouldn't panic over the outbreak of the Ebola virus disease in the country. Fashola, while addressing journalists today, said irrespective of the recent spread of the virus to Port Harcourt in Nigeria, the country was making progress at containing the Ebola virus. The governor spoke when a delegation from telecoms giant MTN visited him to present the state government with some medical kits as part of its support towards curbing the outbreak of the disease.
We do not need to panic. The Ebola virus is not an automatic death sentence. A lot of knowledge is being gained on a daily basis, even at this moment, about the behavior of the virus. And that knowledge helps scientists to prepare even better to respond. And you are seeing that different types of the virus have been identified. We now have clarity about the length of life of the virus. We now have, and that body of knowledge helps in the management that our team have been able to put in place here. We've saved 8 lives, confirmed victims of Ebola who have fully recovered under our management, and in collaboration with health officials of the federal government in Lagos who have worked with us in a very self-respecting and professional team. We've had unfortunate fatalities, and we still have 1 patient, I believe, 2 now, in isolation and treatment. There are a lot of, well, not a lot, a number of people who are contacts, suspected contacts, who are under surveillance. And by surveillance, we are in daily contact and also in visit contacts monitoring. Oftentimes, many of them turn out negative, but this is the brutal work that must be done to check and double-check every possible contact. The paradigm for managing this is containment first and treatment. We must not get to epidemic proportions. We will lose control if that happens. And we, in that sense, we are making progress.
So we are here to lend our support. First of all, to express our appreciation and to lend our support. We had already started supporting their cause by providing call centers where the Ebola hotline, where your doctors are there responding to any inquiries that might ensue. Today, we have come to provide in support a fairly reasonable quantum of personal protective items, sample of which are displayed here, both for the caregivers and for hotline health workers. That's why we're here, Your Excellency. And to also tell you that we wish you and your government God's blessing in the efforts you are making, both in this regard and in others. Thank you very much.
Now, the governor also used that occasion to say a major setback in curbing the Ebola virus in the state was the lack of Ebola experts, which he describes as a major challenge.
Whilst we understand and fully appreciate the humanitarian concerns that propel these things, the real problem is the sufficiency of experienced virologists and Ebola specialists in managing this. And when the sub-region, as it were, is challenged on many fronts, that capacity thins out. And that really is the problem. So it's not always, and at this time, it isn't a money problem. It isn't really an equipment problem. It is a human capacity problem.